Australia has long enjoyed a reputation as a land of prosperity, a nation synonymous with natural beauty, economic opportunity, and enviable quality of life. Internationally, it is often viewed through a romanticized lens: golden beaches, urban modernity, and a relaxed egalitarian culture. However, beneath the surface of this image, a more troubling reality has been developing. A wide range of economic and social pressures are reshaping everyday life in Australia. While not always the subject of global headlines, the cumulative effect of these changes has been deeply felt across the country. Increasingly, Australians are not thriving, they are surviving. And critically, many are beginning to view this struggle as simply normal. This video examines how struggle has become standard in Australia across multiple facets of life. 1. The illusion of prosperity. In previous decades, a full-time job in Australia typically provided economic stability. Secure employment often meant that individuals and families could afford accommodation, transport, and some degree of savings, sometimes even the aspiration of homeownership. But in 2024, this model has weakened considerably. According to the Australian Bureau of Statistics, average weekly earnings now sit at approximately $1,450 before tax. At the same time, median rents for two-bedroom units in major cities such as Sydney and Melbourne range between $650 and $750 per week. This means over half of an average earner's income is consumed by rent alone. Importantly, the housing affordability issue is not confined to metropolitan areas. Data from CoreLogic indicates that regional rental prices have risen more than 30% between 2020 and 2024, with many once affordable towns now experiencing surging demand and limited supply. The financial fragility of many households is underscored by survey data. Finder's 2023 research revealed that 62% of Australians have less than $1,000 in savings, leaving many one unexpected bill away from financial distress. What was once associated with poverty, precarious housing, skipped meals, working multiple jobs, is increasingly representative of middle-income life. 2. Homeownership and the erosion of the Australian dream. Homeownership has traditionally formed a central pillar of the so-called Australian dream, a symbol of financial success, stability, and social status. For generations, it was a realistic goal. Work hard, save diligently, and eventually, you could own a home. However, for many younger Australians today, that dream has drifted out of reach. In the 1990s, the median house price was roughly 4 times the average annual income. By 2024, that figure has ballooned to over 10 times the average income in Sydney and around 9 times in Melbourne. In practical terms, this means first home buyers in these cities are now expected to save deposits exceeding $200,000, a daunting task that often takes more than a decade, even with full-time employment. Many must delay major life decisions, such as starting a family or moving out of shared accommodation, to meet this goal. Despite this shift, the societal narrative remains frozen in time. Homeownership continues to be portrayed by governments, banks, and media as both an individual milestone and a national ideal. Those unable to buy are frequently told to sacrifice lattes or avoid holidays, as if the problem lies in personal spending habits rather than a broken housing system. 3. The rise of the working poor. Australia's employment statistics continue to present an optimistic facade. As of 2024, unemployment remains historically low, and labor force participation is at a record high. On the surface, these indicators suggest a thriving economy and a stable job market. However, beneath these headline figures lies a more troubling reality: the steady rise of in-work poverty. Approximately 1 in 3 employed Australians is now classified as part of the working poor, individuals who, despite having jobs, struggle to afford basic living costs such as housing, food, healthcare, and transport. This demographic includes a wide range of essential workers: childcare professionals, cleaners, delivery drivers, and even degree-holding professionals. These are not marginal or unskilled workers, but people vital to the functioning of society. One of the key drivers behind this phenomenon is the increasing prevalence of insecure, casualized, and gig-based work. Many jobs now come with unpredictable hours, no paid sick leave or holiday entitlements, and limited or no access to superannuation. As a result, a growing number of Australians are forced to take on second jobs, side hustles, or shift work just to stay afloat. While this is often framed as evidence of flexibility or entrepreneurial spirit, labor advocates argue it represents a deeper failure, a systemic erosion of secure, adequately paid work. The normalization of underemployment, low wages, and job insecurity has effectively decoupled employment from financial stability, raising fundamental questions about the fairness and sustainability of Australia's economic model. 4. A mental health system under pressure. Mental health challenges in Australia have escalated significantly in recent years, reflecting both growing societal pressures and increased awareness of psychological well-being. However, while public conversation around mental health has become more open and widespread, access to timely and affordable care remains a major obstacle. According to the Black Dog Institute, 1 in 5 Australians experiences a mental illness each year, a statistic that equates to more than 5 million people nationally. The burden is especially pronounced among younger Australians. Nearly 40% of those aged 18 to 24 report high levels of psychological distress, marking them as one of the most vulnerable cohorts. Despite the visibility of mental health in media and policy discussions, meaningful access to professional support is far from universal. The average cost of a psychology session ranges from $150 to $250. While Medicare rebates are available under mental health treatment plans, many practitioners are either not accepting new patients or have months-long waiting lists. These barriers are particularly acute in regional and rural communities, where service providers are few and far between. Advocates caution that the societal response to mental health remains insufficient. While Australians are increasingly comfortable discussing mental wellness, there is also a troubling trend of normalizing chronic stress, burnout, and emotional fatigue. Feelings that may require clinical intervention are often reframed as just part of life. This mischaracterization can discourage people from seeking help, delay necessary treatment, or lead individuals to settle for inadequate support. As a result, mental illness in Australia is not only prevalent, but often undertreated, a situation that poses long-term risks to individuals and communities alike. 5. A healthcare system in decline. Australia's Medicare system has long been regarded as a cornerstone of equitable healthcare, a structure designed to ensure universal access, regardless of income or background. However, recent data and public experiences suggest this ideal is under mounting pressure, with universal access increasingly being replaced by conditional availability based on financial means or geographic proximity. In 2022, over 80% of general practitioner (GP) visits were bulk billed, meaning patients incurred no direct costs. By 2024, that figure had fallen below 65%, representing a significant decline in cost-free access to primary care. This shift has left many Australians paying between $50 and $90 out of pocket for standard medical consultations, a considerable burden for low and middle-income earners, especially those requiring frequent care. Beyond primary care, the public hospital system is showing signs of systemic strain. Emergency departments are regularly overwhelmed, leading to long wait times even for urgent cases. Elective surgeries, once delayed by months, are now often postponed for years in certain states, placing immense pressure on patients who cannot afford private alternatives. In this climate, private health insurance, once a supplement to the public system, is increasingly viewed as a necessity for those seeking timely or specialized care. Yet with premiums continuing to rise, this option is becoming unaffordable for a growing segment of the population. For many Australians, healthcare access now hinges not on need, but on the ability to pay or proximity to well-serviced urban areas. These developments indicate a significant departure from the original intent of Medicare. Where the system once aimed to provide care based on clinical need, it is gradually shifting toward a model where quality and timeliness of care are dictated by socioeconomic status. This trend raises critical questions about equity, sustainability, and the future of Australia's healthcare model, one that is increasingly moving from universal to conditional access. 6. The university debt burden. Higher education in Australia has long been positioned as a critical stepping stone toward upward mobility and long-term financial security. However, this narrative is becoming increasingly detached from the lived experience of many graduates. University degrees, once seen as reliable investments, are now leaving young Australians saddled with rising debt and diminishing job prospects. As of 2025, the total HECS HELP student loan debt has surpassed $80 billion. The 2023 indexation rate of 7.1%, the highest in decades, caused widespread concern, with many graduates seeing their balances balloon by thousands of dollars in a single year, despite making regular repayments. This unexpected surge effectively punished borrowers for inflation, not borrowing behavior. Meanwhile, the graduate employment market offers little reassurance. Many degree holders are unable to secure full-time roles in their fields of study. Instead, they find themselves underemployed, working part-time, casually, or in unrelated industries, often with no clear pathway to stable or well-paid employment. The promise that higher education would provide a return on investment is increasingly being called into question. This disconnect between educational attainment and financial stability is contributing to a broader crisis of confidence in the value of university education. For many young Australians, the degree they were told would unlock opportunity is now a source of prolonged financial insecurity. 7. Infrastructure falling behind population growth. Australia's population continues to grow rapidly, but infrastructure development has struggled to keep pace. Urban centers such as Melbourne and Sydney are experiencing extreme congestion. Daily commute times often exceed 90 minutes. Public transport systems are frequently overcrowded, and road networks are increasingly inefficient. Outside capital cities, the situation is equally challenging. Many regional communities lack access to essential services, including public transport, healthcare, and education. Parents struggle to find childcare spots, and local amenities are often underfunded or absent. At the same time, substantial public funds have been allocated to high-profile infrastructure projects, such as stadium redevelopments and urban renewal precincts, which, critics argue, provide limited practical benefit to the broader population. This has led to accusations of political misalignment between government priorities and community needs. 8. Political messaging and media framing. Government messaging around Australia's economic health often focuses on favorable macroeconomic indicators. Low unemployment, declining inflation, and GDP growth are presented as evidence of national prosperity. However, these metrics do not capture the lived experience of many Australians. Wage stagnation, cost of living increases, and job insecurity are persistent and widespread. Yet, official narratives often advise citizens to manage their expectations, reduce spending, or simply show gratitude. Mainstream media, largely concentrated in the hands of a few major corporations, has also come under criticism. Reports on financial hardship frequently frame the issue as one of individual behavior rather than structural inequity. Public discourse often emphasizes personal responsibility over systemic analysis, reinforcing a culture in which struggle is internalized rather than interrogated. 9. Cultural stoicism and the silence of struggle. A defining characteristic of Australian culture is the inclination to just get on with it. While resilience is frequently lauded, it can also mask widespread suffering. Financial stress, burnout, and housing insecurity are commonly downplayed. Individuals are reluctant to complain or seek support, fearing stigma or dismissal. Instead, hardship is often expressed through humor, self-deprecation, or silence. Experts warn that this stoicism can prevent collective action. When struggle is viewed as personal failure or as an unavoidable reality, it becomes difficult to galvanize public demand for systemic change. The normalization of hardship in this context represents not just a social condition but a political barrier. Australia remains a country of significant wealth, stability, and opportunity. However, the gap between potential and reality is widening. Across housing, employment, health, education, and public infrastructure, evidence points to growing strain and diminishing accessibility. The normalization of struggle, the quiet acceptance of difficulty as everyday life, poses a long-term risk to the nation's social cohesion and economic health. If left unaddressed, it may entrench inequality, reduce trust in institutions, and undermine future prosperity. A reframing of national priorities may be required. This includes recognizing economic hardship not as a series of individual failures, but as the consequence of policy choices, underinvestment, and systemic gaps. Public awareness is the first step toward meaningful change. Open dialogue, transparent reporting, and active civic engagement can help reverse the quiet crisis before it becomes permanent. Thank you for watching.